Okay, so now in the last segment, we talked about the bones of the shoulder region. And in this segment, I will be talking about the muscles of the shoulder region. Okay, and so there are 6 muscles in this region. They include deltoid, supraspinatus, infraspinatus, teres minor, subscapularis, and teres major. Okay, of those 6 muscles, these 4 of them, supraspinatus, infraspinatus, teres minor, and subscapularis, they form a group called rotator cuff because they form a musculotendinous cuff around the shoulder joint. That's why they got this name rotator cuff. And also they are called sits muscle. You see, with the first letter of each muscle, S-I-T-S. Okay, sits muscle. Now again, another thing that if you look at all these 6 muscles, you will see one end of this muscle is in the scapula, like this one or all these ones, and then their another end is in the humerus. Okay, so these muscles, all these muscles, 6 of them, they are one end is in the scapula, the other end is in the humerus. That's why you see some people call them scapulohumeral muscles because they run between the scapula and the humerus. Now let's talk about the individual muscles. Okay. Okay. So the first we start with the deltoid. Deltoid is the largest muscle in the shoulder region, and that is big and strong, and this provide the typical, the circular, the rounded shape of the shoulder. And this muscle has different parts. On the anterior view, you can see the anterior part attached to the clavicle, and the posterior aspect, you see posterior part of the deltoid, which is attached to this the spine of the scapula. Okay. Now here you can see the whole attachment here, proximal attachment. It extends from the clavicle to the acromion and the spine of the scapula, and its distal attachment is in the deltoid tuberosity, which is in the shaft of the humerus. Okay, and deltoid is a strong muscle, and that is mainly its main function is the abduction of the shoulder. Okay, and one more thing, so function is action of the muscle is important, so you need to know that deltoid muscle is the strong abductor of the shoulder, and it is innervated by axillary nerve. That is another important information that you need to know. And one information about deltoid you need to know is that it's a common site of intramuscular injection. You see, from your experience, you may have seen that it's commonly used for the intramuscular injection. Now let's deal with the rotator cuff as a whole. Before I talk about the rotator cuff, let's talk about the teres major, because teres major is not a part of the rotator cuff. Teres major muscle is attached to the inferior angle and also the lateral border of the scapula, and its distal attachment is in the intertubercular sulcus of the humerus. And the teres major is an adductor of the shoulder, and it is also a medial rotator of the shoulder. Okay. Now let's focus on the group which is called the rotator cuff. This group is formed by, as I said, 4 muscles: supraspinatus, arising from the supraspinous fossa, the infraspinatus, attached to the infraspinous fossa of the scapula, and the teres minor. All of them you can see from the posterior aspect, and the teres minor is attached to the medial, the lateral border of the scapula. Okay. Now, and from the anterior aspect, this is subscapularis attached, and then it goes again towards the shoulder joint. Now, if you look at this one here, you see all the muscles. Supraspinatus you can see coming from the top. The infraspinatus and teres minor are coming from the posterior aspect. That's why you don't see. You can see them here. So all of them, they converge towards the upper end of the humerus and forming a musculotendinous rotator cuff around the shoulder joint and provide stability to the shoulder joint. When we talk about the shoulder joint, I will mention this function again. Now you can see the shoulder joint here between the glenoid cavity of the scapula and at the head of the humerus. And to stabilize the joint, these muscles, all 4 of them, one coming from the superior aspect, one coming from the inferior aspect, and these 2 coming from the posterior aspect, all converge on the upper end of the humerus or proximal end of the humerus, exactly to the two tubercles to form a rotator cuff and stabilize the shoulder joint. Now, this is the upper end of the humerus. If you hold the upper end of the humerus with your thumb on the lesser tubercle and your other three fingers on the greater tubercle, these three fingers will represent the three facets on the greater tubercle. This provides attachment to the supraspinatus. This provides attachment to the infraspinatus. This one provides attachment to the teres minor, and the thumb, which represents the lesser tubercle of the humerus, will provide attachment to the subscapularis muscle, this one, which is coming from the anterior surface. Okay, and if you look at the anterior view, actually, so if you look, this one is, you are looking at the glenoid cavity. So head of the humerus will be here to form the shoulder joint. You see how these four muscles are approaching the shoulder joint. This one is supraspinatus coming from the top. These two, infraspinatus and teres minor, coming from the posterior aspect, and this one, subscapularis, coming from the anterior aspect. All of them converge, on the shoulder joint and form a musculotendinous rotator cuff. Okay. Now, if you look at this muscle, the position, this is the main. If you think of the disorders of the shoulder joint, two important ones are the impingement and tendinopathy. Okay, so now the muscle which is most of the time involved in this impingement and tendinopathy is the supraspinatus. Okay, now look at the supraspinatus here. Supraspinatus is coming from the supraspinous fossa. It is traveling right under the acromion and coracoacromial ligament, and this is coming to the and blend with the other muscles tendon in this and the upper end of the humerus, right? So below it is the head of the humerus. Above you have again two bones and this strong the ligament. So which means the supraspinatus is traveling through an area with a fixed dimension. If there is any swelling of the supraspinatus tendon, or there is a bursa actually around here. Bursa is a fluid filled bag. I will talk about the bursa in another lecture. So if there is any swelling in the bursa or swelling of the supraspinatus tendon or development of some bony spots on the undersurface of the acromion, that can cause the impingement on the supraspinatus tendon, especially when you abduct. If you think of a baseball pitcher, okay, so whenever he pitches the ball, every time he does it, so you can imagine how many times they do it. So every time you abduct the arm, so it may go and touch the undersurface of this one, right? So now if there any swelling or any growth of any bony spot, that can easily cause some the problem to the supraspinatus. One more important thing, why supraspinatus is mainly involved, because supraspinatus, the tendon of supraspinatus is relatively avascular, and that also make it more susceptible to any disorders that involve the rotator cuff. Now again, when we talk about the action of the deltoid, we said it is the strong abductor of the arm, but the initiation of the abduction is done by supraspinatus. So that is a very important function of supraspinatus. So when the initial 15 degree of abduction is achieved by supraspinatus, then rest of it is done by the deltoid. Okay, so both supraspinatus and deltoid, they are abductors of the shoulder or abductors of the arm, but initiation and first 15 degree of abduction is done by supraspinatus, and the rest of it is carried out by the deltoid. So now if we talk about the action of these muscles, we call them as a group. They are rotator cuff and they stabilize the shoulder joint. That is their very important function. In addition, supraspinatus is an abductor of the arm. Infraspinatus and teres minor, they are, in addition to serve as a rotator cuff, they are lateral rotators, and subscapularis is a medial rotator of the shoulder joint. Now, see the shoulder area, they contain a lot of muscles and muscles. So these muscles need blood supply and nerve supply. So those nerves and blood vessels, they come either from the neck area or from the axilla. Okay, so there need to be some gateways for those structures, for those neurovascular structures to enter the posterior scapular region. There are 4 such areas: the suprascapular foramen, quadrangular space, the triangular space, and triangular interval. Okay, now if we look at one by one, suprascapular foramen. Suprascapular foramen is formed by, do you remember we talked about the suprascapular notch? And there is a ligament run on top of it, forming a foramen here, suprascapular foramen. If we look closely in this area, you can see this is the suprascapular notch, and this is the ligament running on top of it, forming a suprascapular foramen. Okay, now 2 structures travel to the posterior scapular region in this area. One is the suprascapular nerve, the other one is the suprascapular artery. Now, if you look carefully, you see the nerve is coming right through the foramen, but the artery is coming from that area, but it is going over the ligament, which means over the foramen. That's why we say the army goes over the bridge, which means the artery is going over the ligament, and the navy goes under the bridge, that is going through the foramen. Okay. Now let's come to quadrangular space. This is a space bounded by muscles on 3 sides. On the top it is teres minor, and on the bottom it is teres major, and the medially this is long head of the triceps, and laterally it is the surgical neck of the humerus. In between these 4 structures there is a quadrangular area or quadrangular opening, and that allows 2 very important structures. One is the axillary nerve, which provide innervation to the deltoid and teres minor, and the posterior circumflex humeral artery. So these are the 2 very important structures travel through this area, and this area has a clinical significance. It is called the quadrangular space syndrome. You see, because this area is bounded by muscles on 3 sides. So now the hypertrophy of any of those muscles or fibrosis of those muscles can impinge on the axillary nerve, and if that happens, that will cause the weakness of the muscles innervated by axillary nerve. The muscles again are the deltoid and teres minor. Okay, so and another area is on the other side of the long head of the triceps, which is bounded by teres minor above, teres major below, and long head of the triceps on the medial side, on the lateral side actually. And the structure that travels through this one is the circumflex scapular artery. And the last one is the triangular interval, that is the space between the long head of the triceps, then teres major, and the shaft of the humerus. And the most important structure that travels through that triangular interval is the profunda brachii artery, which provide blood supply to this area. Okay, now let's have a quick review of the structures that we see. This is a cadaveric image. Before you look at this one, you should look at this one first, because this will give you the orientation, which area you are looking at. Unless you look at this one first, it will be difficult for you to understand this one. So you see, which means the area in the box is enlarged here. So this area, which means we are looking at the shoulder from the posterior aspect, right? Now see how many structures you can. This is a quiz time for you. So this is the spine of the scapula, which means this is the infraspinatus. This is teres minor. You cannot see supraspinatus because this is under the another muscle, which is the trapezius here. This is the quadrangular space here, and you can study the boundary and the structures traveling through this one. You see the axillary nerve going to the deltoid muscle, and a small branch is going to the teres minor as well. This is the triangular space. This is teres major. This is the long head of the triceps. Okay. So this is another muscle here. We don't talk about this one in this lecture. This is actually the latissimus dorsi muscle. So anyway, this is a cadaveric image from your dissector. So you will find a lot of images like this, and the cadaveric image, if you try to understand the cadaveric image, it will help you understand the structures in your in the prosected cadavers, actually in the donors. Anyway, I think that's all about the muscles in this area. Thank you. And again, as I said, if you have any question, don't hesitate to contact me. by email or text message or whichever way is convenient for you. Thank you.